Understanding tendon healing. Tendons are extremely durable structures that connect muscle to bone and allow us to move efficiently and powerfully. When they're healthy, they act like springs, storing and releasing energy every time we step, jump or run. But when they become injured, they can become painful, stubborn, and can be frustratingly slow to recover. For decades, tendon pain was thought to be due to inflammation, and it used to be referred to as tendonitis. However, extensive research led by Professor Jill Cook and her team at La Trobe University has transformed how we understand tendon injury and healing. We now know that most tendon problems are degenerative rather than inflammatory. There are cell changes within the tendon, which is the primary driver of pathology and pain. Tendon issues develop gradually from overload or underload, not from a single traumatic event. You might remember it getting sore during or after a particular run, but that's only part of the story. And perhaps most importantly, we've learned that healing a tendon is less about reducing inflammation and more about restoring load tolerance. When all is said and done, fixing a tendon injury, despite what the MRI scan might show, is about restoring function. Being able to hop, jump and run again should be the target. Accomplishing that should be the focus in tendon recovery. What are the phases of tendon healing? Tendon healing is best understood as a process that moves through three broad but overlapping phases. And this is slightly different to how they present clinically, which I'll touch on. But let's look at the reactive phase, the disrepair phase, and the degenerative phase. Understanding where a tendon sits along this continuum can help guide treatment. The reactive phase can last from initial days to several weeks. This is where the tendon's initial response to a sudden excess in load, that could be a sudden spike in training, a new exercise routine, or even a return to activity after resting or after recovering from a previous injury. A few weeks of inactivity is enough to mean resumption of normal training as you see it could be a spike in load. There is a reaction in the tendon cells, and this can cause the tendon to swell slightly. It's not inflammation exactly, it's short-term adaptive response designed to protect the tendon. At this stage, the tendon can and often does fully recover if the load is managed properly. I would recommend avoiding directly loading this tendon for 7 to 10 days. Keep moving, but just let symptoms settle. The key management steps here include reducing painful load, but not completely resting. After a week or so, isometric exercises, this is holding muscle contractions without movement, can reduce pain and maintain strength. But I would allow a week to pass before you jump into that. Maintaining general fitness by training around the injury. That might mean off-feet conditioning like the bike or the cross trainer, and avoiding, for lower limb injury, running or jumping. The goal is to calm symptoms and allow the tendon to adapt, not to rest it into weakness. Phase 2 is tendon disrepair. This can go from weeks to several months. If excessive loading continues or recovery is insufficient, the tendon begins to show structural changes. Collagen fibers become disorganized and small areas of the tendon may start to lose their normal architecture. The good news is that at this stage, the process is still reversible with appropriate intervention. Treatment focuses on progressive structured loading to stimulate repair and the alignment of collagen. This includes heavy, slow resistance training. So controlled, heavy strength work like slow squats, calf raises, leg press, etc. Performed 2 to 3 times per week. Research shows this type of loading improves both tendon structure and pain. A gradual reintroduction of functional activity. So carefully increasing running, jumping or lifting volume over time. But that has to be done gradual, avoiding spikes. At this stage, avoiding passive treatments like massage, ultrasound or rest. These do not restore load tolerance. It might feel nice in the short term and can be an adjunct to loading, but it's not doing anything to actually help you return to activity. The principle here is clear. Tendons get better when they are loaded appropriately, not when they are rested indefinitely. So phase 3 is the degenerative phase. This can go from several months to several years. In long-standing cases, especially in older adults or tendons exposed to repeated overload, parts of the tendon may become permanently degenerated. These regions show cell death and disorganized collagen. However, even in these cases, not all hope is lost. Most tendons have enough healthy areas alongside the degenerative ones, and these can adapt positively to training. Think of it like a ring donut. The hole in the middle represents the degenerative area, the part of the tendon that's disorganized and weaker. But the key point is that the healthy part of the tendon still does the work. Rehab is effective by ensuring that that outer part of the donut, the healthy part of the tendon, still does its job and is as strong and capable as possible. As long as this part of the tendon is load tolerant, the tendon can still function normally and completely pain-free. The goal in this phase is to strengthen and optimize the capacity of the healthy tendon tissue and the surrounding muscles. Treatment remains load-based. Continue progressive strength training. Heavy, slow resistance or isometrics, concentric and eccentric contractions of the muscle as tolerated. Modify aggravating activities, so reduce high speed or high impact load temporarily to allow symptoms to settle. Addressing contributing factors such as muscle weakness and energy storage activities that exceed the tendon's tolerance, like hopping and jumping. All of this is short term. It will be reintroduced as your rehab progresses. While the degenerative areas themselves may not heal fully, pain and function can improve dramatically with the right approach, even in these degenerative tendons. The most common clinical presentation is referred to as a reactive on degenerative tendinopathy. This is the reality for most people. It occurs when a tendon with some previous underlying degenerative changes, think of the donut with a small old hole in the middle comprised of disorganized weaker collagen, is suddenly overloaded, leading to a new reactive response in the surrounding tissue, still healthy tissue. So the healthy part of the tendon becomes irritated after a spike in load. The pain comes from the healthy part of the tendon, and that's what needs to be treated. Let it calm down with general activity and begin loading it up in order to reduce pain and increase capacity. A graded loading approach is again the cornerstone of this treatment. This can be frustrating for athletes as they feel they always have to manage their tendon issue. In a lot of ways, they do need to be mindful of it and get their load right, avoiding major rest periods or major spikes in activity. So timelines, how long does it take to heal a tendon? One of the hardest realities for patients and clinicians alike is that tendons heal very slowly. This is partly due to their relatively poor blood supply and the slow turnover of collagen tissue. Typical recovery guidelines. A reactive tendinopathy can be 2 to 6 weeks with appropriate load management. In the disrepair phase, it can be 3 to 6 months with structured rehabilitation, not just rest. In a degenerative tendinopathy, this can often be 6 to 12 months or longer for meaningful, lasting improvements. Final thoughts on tendon healing. Tendon pain can be one of the most frustrating conditions to manage. It doesn't follow a simple linear healing path, and progress often feels slow, but with patience, persistence and the right approach, most people will make a full and lasting recovery. Tendons do not like holidays or surprises. Load management and loading the tendon is the cornerstone of recovery. You might feel better if you rest, but on resumption of activity again, if that tendon has not been made more load tolerant, problems will arise. If you're dealing with tendon pain, remember, pain does not mean damage and you need to be really worried about it. Resting alone does absolutely nothing to fix the tendon. The solution lies in progressive, meaningful loading of that tendon. Healing a tendon is a journey, not a quick fix, but it's one that leads to lasting strength, confidence, and the ability to keep doing whatever you love. If you have any questions on this, please feel free to comment below or reach out for help.